On this week's episode, we're going to be talking about rib injury and proper treatment. And on this week's episode, we're going to be talking about rib injuries and rib pain. Dr. Rob sees a lot of people that come in with rib injury. How would we know if we've injured a rib? What would it feel like?
Usually people are going to feel like a sharp stabbing pain, like behind their shoulder blade. It'll hurt with a deep breath. You'll feel it when you cough, sneeze, things like that. The pain can start in the back and kind of wrap around to the front of the chest as well. Commonly what we see though is just that sharp stabbing pain right by the shoulder blade.
Okay, so how would I injure my rib? How does that typically happen? I've never had that happen before.
A lot of people, like coughing and sneezing, can kind of throw things out. If we have
Really?
any sort of rotation problem in the mid-thoracic spine where the joint kind of turns, so it almost pushes the rib head up a little bit. We'll see problems with that as well. So rotational injuries too.
So what do we do in the office to help people with rib injuries?
In the office, I mean, we'd adjust the rib itself, kind of get that moving again, and make sure we mobilize the mid-back where the rib articulates with the spine. We definitely want to get that area moving as well.
And is it typically a one-time treatment and it's kind of back in place? Or?
For a lot of people, it's pretty quick turnaround. Some people's, if it's been going on for a while, it does take a little bit more. But most people, when it happens, they know immediately that there's a problem there, and all right, let's take care of that.
So I guess if it happens to somebody once, is it likely to happen again?
It can happen again, but the biggest thing is just keeping mobility throughout the spine in general, which that should minimize a lot of these issues.
Okay, awesome. And I think after Rainey's Fitbit, we're going to talk about how to mobilize the rib and some things you can do at home with a lacrosse ball and a foam roller. Yep. To help if you feel like you've misplaced rib or are experiencing any sharp pain. Yep. Or you should probably just come into the office.
Yeah, we'll check it out.
Yeah. Okay. Rainey's Fitbit is up next.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week, I want to talk about our wellness program that we have here in the office. It's called 8 Weeks to Wellness. It consists of 5 different components. We have chiropractic, massage, nutrition, exercise, and then mindfulness or meditation. The two that I really focus on are the diet and the exercise. So I want to kind of talk about those today. Maybe give you a visual about what we're trying to teach you, because a lot of people are out there trying to find a shortcut to lose the weight that they have in mind for when they start the program. But I want to give you a visual. So burning 3,500 calories during exercise would actually equal out to burning a whole pound of fat. But I also want to let you know that that's going to take, depending on your size and the speed that you're going on a treadmill, that's going to take you 3 to 10 hours on the treadmill. And I don't recommend going out and doing that because being on a treadmill for that long can be very hard on your body. But I just want to give you an idea that this is hard work to burn the calories. And that's why we can't really find a shortcut to help you lose that weight so quickly. That it does take time and it takes hard work. Also, with our exercise, we really push on building muscle. Building muscle is going to help keep off the fat permanently. And I'm not talking about really bulking up, getting bulky muscles, but toning the muscles and keeping them strong, again, to help keep the fat off and burn the fat and burn those calories. And again, nothing beats proper diet and exercise. So there really are no other shortcuts. This is really, truly the way to go. And that's what we push here in the office. So if you're interested in this program, call the office to find out more, or even check on our website. We have a full page dedicated to the program, so you can kind of get some more information there as well. But yeah, we would be happy to help you if you're interested. That's been this week's Fitbit, and we'll see you next time.
Alright guys, we're back, and before we show you the lacrosse ball and the foam rolling exercises, we're going to actually show you what an adjustment would look like, or somebody that were to come in and just...
We're just going to check it out.
Yeah, check it out. So hypothetically, what would happen if I'm feeling pain?
I would first, I'd have you face down because that'd be kind of where I'd start checking it. Now we can have, essentially we can have a rib problem from here, and then we can feel them down as low as about here, and they can kind of wrap in this direction. Most of them that we find in the office we'll find in between this area. But what we would mainly do, we just want to check the spine, find kind of where we're moving and where we're not. Now she does feel a little bit tight right here, and it feels like over to the side right here. Is there any tenderness in there?
Yeah.
Yeah. So with this, we would essentially figure this area is what we're going to be working on. And what we would do, is we would just have an adjustment and kind of lightly push that back into position, and then we'd also adjust these joints as well, just to get the joints moving a little bit better. Most likely do some muscle work in this area, because if we do have a rib out of position, we could have a little bit of pain with that as well. So doing some muscle work would help with some of that pain.
So we just did an adjustment with ribs. If you're feeling pain, we showed what an assessment would look like in the other room. So now we're going to go through mobilizing and some stability exercises.
So first thing, I'm going to have you, so you're back on this. And what you're going to do, so I'm going to have you bring this arm across. So you're going to pull the shoulder blade out of the way, and then you can kind of roll along the side of the spine and really kind of dig into that area.
Oh man.
Still pretty tight?
Yep. Yep. So in the assessment, we found that my right side is like super tight, and this feels really good.
Now, I would recommend starting with a foam roll, but if you feel like that's not getting the area and you need something a little bit deeper, you can get a lacrosse ball. You would do the same thing, and essentially cross the arm over, you can lay back, and you can just kind of roll on that. That is going to dig in a lot deeper, so you might not want to start with that one, but eventually we can kind of get to that, because it's going to loosen the tissue more.
Yeah, and I'm rolling around
the shoulder blade.
The shoulder blade.
Yeah.
All right. Yeah, this feels awesome. Okay, so mobilized. So now we're gonna.
So now we'll head over here. Essentially, what we want to do, we're going to start looking at strengthening some of the muscles around the shoulder blade to kind of stabilize the area. So it's like we're going to be in a push-up position against the wall, and it's like we're going to do a push-up without bending the arm. So it's like the shoulder blades squeeze together, and then they fan back out right here. We're going to strengthen a lot of these muscles in through here. Can you feel it in through here while you're doing it?
Oh, okay. Yeah, totally.
And that's also, it's going to help kind of mobilize the shoulder blade as well. So it's not like the shoulder blade's kind of sticking against the rib cage. So then the last one that we were going to do, I'm going to have you lay on your left side of your head right up here. And with this one, this is just going to help strengthen some of the rotator cuff muscles. And what we would do, this is a 5-pound weight. You don't really want to go more than 5 pounds with this, but you want to hold the elbow against the body and then just rotate out like that. And with that, we are going to strengthen a lot of her shoulder blade right back through here. A little tight doing that?
Yeah.
I mean, can you feel
this? This is, yeah, oh, yes, very much. Yeah, I would say keep it very light, because this is even difficult for me. Oh, man. And how many sets or how many reps?
So, I mean, when you're hurting, I would say probably do, 10 of the push-ups against the wall, and then you could do 10 of those as well. Maybe do that a couple of times a week. But with the mobilization, as long as it's hurting, you could do that a couple of times a day, really.
Yeah, wouldn't hurt.
Yeah, but I mean, with the exercises or with any of this, like if it's too painful, obviously stop, let us know, and we'll figure out what's going on.
So always mobilize first.
Mobilize first, and then kind of strengthen things after that.
Okay, got it.
All right.
Thank you. All right, so that concludes this week's episode. Make sure to check out our other short YouTube videos on our page, and we're also on Facebook, so make sure you check us out there. We will see you next time.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.